And we begin at 5 with developments surrounding Oregon's Measure 110 and a new report from the Secretary of State with calls from some to change or repeal the law that decriminalize small amounts of hard drugs while also intending to provide more funding for treatment. Thanks for joining us. I'm David Molko. It is those dollars that officials have zeroed in on, including whether they're being spent efficiently and effectively. Let's bring in Alma McCarty in the newsroom. Alma, what did the audit find here?
Well, David, the 53 pages do not try to answer all the questions when it comes to Measure 110. Auditors write that's a complicated topic, and whether it's working, a complicated question. They're focusing in on services provided through behavioral health resource networks and the $260 million in grants approved by the Oregon Health Authority. Acknowledged as controversial from the start, officials say Measure 110 has attracted more scrutiny since voters passed it in 2020. The law was intended to fund new treatment services, but those were slow to roll out, and the decriminalization piece of the law began as the fentanyl epidemic exploded. Now the first of its kind measure faces proposed reforms, critics seeking to recriminalize possession. We spoke earlier this year with those who seek to fix Measure 110 and those who pushed to pass the measure in the first place.
We're failing our communities right now. We've got people who are dying from overdoses. We've got children and teens who are exposed to drugs, and we have communities that are struggling with increased crime. This is an urgent issue where we have to help our Oregonians out and move us forward so we can promote people getting into treatment and recovery.
We've already tested the idea if criminalization was the way to answer addiction. We have 50 years of proof that criminalization has only created a lot of harms.
Amid this backdrop, a new audit takes a narrow look at grant funding for treatment and recovery services throughout the state. The Secretary of State cautioning that the report answers a series of questions from lawmakers and is not, quote, a measuring stick for the law. She says the audit will help the Oregon Health Authority put the right structures in place to administer the treatment side of Measure 110. So here's what auditors found. In general, community-based treatment and recovery services to help people struggling with addiction have grown under Measure 110 due to $260 million in grants from OHA. That money went to 233 network service providers, and officials expect to award another $150 million through June 2025. But the report points out ongoing challenges, too, from a slow rollout of grant money to low spending, meaning that in some, often rural counties, networks aren't providing all the required services to the people who need them. Those can range from harm reduction to peer support to housing and treatment. Auditors also found challenges in staffing, collecting data, and overseeing Measure 110. Recommendations from the report include OHA presenting the legislature with a plan to report Measure 110 outcome metrics, better report staffing, improve data collection, and identify gaps in care and barriers to service in each of Oregon's 36 counties. Now today, OHA's behavioral health director issued a statement following the audit saying they agree with the recommendations and they know many people would not have the opportunity to receive life-saving and life-changing services without Measure 110 funding. Of course, this is merely a snapshot of what is in the full report. You can read that whole audit. We'll have a link up to it on KGW.com. David?
Yeah, the conversation and the efforts continue. Thank you, Alma.